This is Physician Spotlight, where we highlight top physician specialists and technologies in the mid-Michigan area. I don't know if you've ever experienced heartburn, but I know that I have, and sometimes it can be so painful that it feels like I'm having a heart attack. I mean, it's just very painful. And today I have with me Dr. Gary Wease, who's going to talk to us about a new technology for acid reflux and heartburn. So welcome.
Thank you, I appreciate it.
So tell us about the difference between heartburn and acid reflux. Is that the same thing, or?
It is. I mean, there's several different terminologies depending on who's speaking. Physicians refer to it as GERD or gastroesophageal reflux disease. Patients tend to call it heartburn or sometimes reflux. At
what point does someone present to your office that is going through, heartburn symptoms, and at what point do they get to talk to you about this new procedure?
Well, typically what will happen is somebody will develop symptoms. They're fairly mild. They'll mention it to their primary care doctors. Primary care doctors will generally start them on some medication to see if that's effective. Most of those medications are based on reducing the amount of stomach acid that we have. If those medications fail, then they're referred for diagnostic testing. If the diagnostic testing reveals appropriate anatomic features that would benefit from a surgical correction, then the patients are sent to me.
Okay, and what kind of symptoms would somebody have?
The most common symptoms that we see are burning in the chest following eating. Sometimes when people sleep at night, if they lay flat, they feel like the material in their stomach is coming up, causes them to have chronic coughing. And one of the other things that we've seen lately is dental complaints. People go to their dentist, they find out that their enamel's eroded because they're continually refluxing acid into their mouth, and that has a deleterious effect on the enamel.
Ah, okay. So now the procedure that you do, tell us a little bit about that.
Well, the procedure that I do is what we call transoral fundoplication, and a fundoplication is a fancy word for saying that we wrap the stomach around the esophagus to reconstruct the tissue valve that exists between the stomach and the esophagus. And it's that tissue valve that's the barrier that closes off the esophagus and prevents reflux. In the past, the surgical procedure to perform that was done laparoscopically. What we've done is we've taken that same procedure and turned it into an endoscopic incisionless procedure.
Oh, that's great. Now, how long does this procedure take?
Typically takes about 30 to 35 minutes to do.
Okay, and the recovery time?
Generally, I tell people to take it easy for about a week, but there's a lot of people who say we'll have it done on Friday and go back to work on Monday.
Oh, wow. And are people going to find that it just reduces, completely their heartburn? I mean,
well, what I try to explain to people is when you're doing an operation for a symptom like heartburn, it's a lot like doing an operation for back pain. If you tell people that they're going to be 100% cured, that's difficult to promise somebody. It's not like a broken arm where you say, when I put a cast on, it's going to heal 100% and you'll be fine.
Right.
So I try to tell people what I expect is an 85% reduction in the symptoms based on where they are now.
Now, I understand there's only a handful of physicians across the country that are doing this procedure, and you happen to be one right here in our area. So is that right?
Yeah, I think there's probably right about 100, maybe slightly less than 100 people in the country who are doing this.
That's great. And how many people present with this problem? Is this quite common, or?
Overall in the country, there's probably about 40 million people that have a significant amount of reflux, and I probably see around 5 patients a week just for this.
For more information about Dr. Gary Wease and the Wease Reflux Center, visit our website at physicianspotlight.com.